Hi, everyone. Welcome to the ADHD Toolbox, your resource for helping your child overcome behavioral and learning challenges and self-regulate. I'm your host, Bob Dietrich. Our special guest today is Dr. George Sachs. Dr. Sachs is a licensed child psychologist, licensed adult psychologist, and specializes in the treatment of ADD, ADHD, autism spectrum disorders in children, teen, and adults. Dr. Sachs, welcome to our show.
Thank you very much. It's a pleasure to be here.
Thank you. Thank you. And it's a pleasure to have you on our show. We have lots to cover today. And so I'd like to jump right in. Today, we're going to talk a little bit about treatment, but we're also going to talk about and discuss what to focus on as your child grows older, as he grows into his teen years and into adulthood. And I think that's super important because a lot of people don't, they're not expecting it. They don't know what to expect. There's so much focus on the younger kids and what to do at that age that you know, sometimes you lose track of what do you do now when they're teenagers. You know.
Exactly.
So let's start off with treatment. A lot of people, you know, there's gray areas. Some people are afraid of medication. Some people don't know what it means. What are some of the treatments and what should people know about treatment of ADHD?
Well, there is a gold standard for the treatment of ADD, and that's something that I do support and believe in, and that is medication and behavioral therapy and parent coaching. So that's what I find is the best treatment. My practice is holistic in the sense is that we look at the entire child and the family and their environment and the school and see what treatments are the best for them. But honestly, what I found that works really well with kids is, as I said, medication and some sort of therapeutic support for both the child and the parent. That's not necessarily the case with adults because I find that a lot of adults stop taking the medicine and then they're left with really nothing unless they have some kind of a therapy. But kids, because the parents give them the medicine, take it. And yes, there's tremendous research on the benefits of medicine, and there's also side effects which you have to talk to your psychiatrist about. But the value of coming to someone like me, who's a child psychologist, is that I don't prescribe medicine. I have connections and relationships with child psychiatrists, but I think the first stop is a child psychologist to get adequately diagnosed and find out exactly what's going on. And then you can use the psychologist as a consultant and a therapist in addition to a child psychiatrist. So a lot of people don't know the difference between those two, but I think both are important and necessary. The tendency with child psychiatrists is just to prescribe medicine, and because they're on a different clock, as far as the amount of time they can spend with a child. So that can be a problem when they just focus on medicine. So again, I have seen really positive results from medicine in children. But I also spent a lot of time working with the schools, figuring out the best situation and environment in the classroom. Is that the right classroom? Is that the right school for the child? If so, how can I work with the parent and the teacher to support the child in that classroom?
Got it.
And then I also spent a lot of time with the parent setting up behavioral plans at home that keep the house calm, less chaotic, and motivate and support the child in new behaviors. While there is research that individual behavioral treatments can work with children, I don't do those. Why is that? Because I find that the group environment works better for children. It's more fun and motivating, and they enjoy being with other kids as opposed to coming once a week to see some adult in an uncomfortable environment. Although as a child psychologist, I try to have fun with the kids and we have games and things like that. But I think in the group environment, you really see, at least I see as the therapist, I really see the child's true colors emerge. And that's when you see how the ADHD impacts them and their relationships. So I prefer what I call the social skills groups to working individually on any kind of behavioral problem. I mean, I tell parents it's hard enough to get an adult to meditate or control themselves, and it's extremely difficult to get a 7-year-old to do that. But I have social skill groups here called the Dragon Masters. So it's got a fun name, and there's kind of a CBT component where when the children do certain things in the group, they level up to different levels and get a new dragon t-shirt. So you can see, obviously that's fun. And,
Right.
And also I get to see, as I said, the child live in their symptoms are usually more expressed in that environment. And then I can really work with the parent on, I can see, oh, I see how this is manifesting. Let's work together on certain behavioral things at home. So I think that's the best, to have a child psychologist involved, to do the therapy and kind of the consultation with the school, to do the initial diagnosis, and then depending on the parental wants and needs, a child psychiatrist to meet with once a month to receive the medication.
Now, there's lots of questions around the medication. I'm sure parents have if they start taking it now as a child, are they going to take it into their teen years? When do they come off? How does that happen? Or is it for the rest of their life?
Okay, this is a common question and fear. And I talk in realistic terms, in the sense of what I actually see happening, not what the research says happens, because it's all different. A lot of research is done in university labs where it's a very controlled environment. But what I realistically see is parents come to me around 1st to 3rd grade. Usually teachers make recommendations on getting evaluated. The parents are afraid of medicine and they wait a little bit. The problem with that is that the teachers find out, because the parents tell them that their child has ADHD, and then, which makes the teachers very happy that the parent brought them for an evaluation. But after 6 months or a year of the behaviors continuing at school, the teachers can become frustrated and often annoyed and take out a little bit of that unconsciously on the child. So that's not helpful. That's why I encourage parents to consider medication after, assessing a little bit further. And so this might actually lead into our second conversation about the lifespan of ADHD, because what I see happening is the child will take the medicine willingly until about 6th, 7th grade. And then they become an adolescent, and then they say, no, I don't want to take that anymore. And it's very hard to make a 13, 14, 15-year-old take something they don't want to take. So I realistically see a lot of teenagers stop taking the medicine because they don't like the stigma, or they don't like how they feel, etc. Sometimes they tell me that it makes them feel less funny. And it's very important, as you know, to be funny as a teenager and socially connected. So, but then they get to college and there's less structure. The parents aren't involved. The school's not involved as much. And they tend to hit the wall, so to speak. And there's a lot of problems that happen in the transition from high school to college. And then I see the kids start to rethink their medicine. The value of medicine. Oh, wow, this actually works. I can actually use this to my benefit, and nobody's forcing me to take it. It's my own decision to take it. And then I usually see the kids take that maybe as needed or every day until they graduate. And then after graduation, there's often a drop off again until they're struggling at work in their first job, and then they may take it again. But I do have some clients that take it every day, but the idea of taking your medicine every day for the rest of your life, that may be what is encouraged, but that's rarely what I see actually happening. So if I were a parent putting a 3rd grader on medicine, I wouldn't assume that they're going to have to take this their whole life. And there's a lot of research that says that kids actually outgrow ADHD, a lot of the symptoms, not all the symptoms, but a lot of the symptoms as an adult. I forget the number, but it's somewhere around 30% of kids diagnosed with ADHD outgrow it.
Got it. Got it.
So,
Okay.
so that's, I say just try it to get through elementary school and middle school and high school.
Got it. Got it. How does what happens with ADHD? How does it affect the child? What's happening in the brain, and does it make them calm down? Does it help them focus? What's going on with the medicine in particular?
Well, I'm not a psychiatrist or scientist or
Right.
neuros. So
Mm-hmm.
I don't know exactly what's going on, and I don't know if even the pharmaceutical companies know 100% what's happening in the brain.
Mm-hmm.
But it has to do with dopamine and increasing dopamine in the synapses, which seems to have an effect on focus and executive functioning, particularly in the frontal lobe,
Mm-hmm.
the front part of the brain. But I mean, that's a very basic understanding of what's happening. But there's
Right.
other research now that shows it has a lot to do with the back of the brain and the motor cortex. But it seems to work with children.
Got it. Got it.
And it doesn't make them zombies to the extent that parents fear that it does.
Got it.
So, I mean, again, I'm not a huge, nobody wants to put their kids on medicine, and I support alternative treatments, but I've seen the medicine work.
Okay. Now, you also talked about behavioral therapy. I think you talked a little bit about it with the environment in the classroom. What are some of the other behavioral therapies that that you do that you could let our parents watching the show know about, so they understand what's available with regard to behavioral therapy?
Well, one of the major things I think is really important, especially from like second to fifth grade, children are especially motivated by points and stickers and rewards. So I recommend a very simple reward chart, which can be done in conjunction with the school teacher. So I do think it's important for the parent, the child psychologist, and the teacher to coordinate on a behavioral plan that's simple and easy to implement and crosses over so that the child feels like the parent and the teacher are also on the same page. So simple is key, because often I hear parents talk about, oh, I did a plan, but it didn't work. Mm-hmm. Well, when I investigate, the plan is one of these elaborate charts with Monday through Friday and 5 different behaviors on it. And the problem with that is it's very confusing for the child and difficult for the parent to maintain over more than a month. So this is what I explain to the parent at home. I say, take a blank piece of paper from the printer and just write one behavior you'd like to improve or change at the top of the page. And that could be brush your teeth every night, or get in bed at 7 o'clock. One behavior. And then it's simple positive reinforcement. Whenever you see the child do that behavior, or the child does the behavior, you give the child a check or a star. And again, you can use stickers, but just a pen and drawing in the shape of a star works. Simple is easier and more successful. And then I say, okay, when you get, and you don't take stars away. If the child doesn't brush their teeth, that's okay. But you encourage them to brush their teeth, and then when they do, they get a star and they're motivated to continue. But there's no negativity involved. And then when they get 10 stars, and that can happen over 30 days, that doesn't necessarily happen over 10 days. Mm-hmm. If they get 10 stars on this blank piece of paper, they get a small $1 or $2 toy. And then when they get 30 stars, which could take 2-3 months, they get a $10 toy. So that's as simple as those kind of behavior plans actually work. And then every 3 to 4 months, you can just change the behavior, take the paper down and put up a new paper.
Yeah.
And in the school, I also recommend doing something very simple and working on one behavior at a time. Some of the teachers already have systems, green, red, yellow systems in place, but sometimes the kids need a special system with a sticker. But again, I support a very simple very easy to maintain and follow through system.
Awesome.
So that's what I recommend for the behavioral treatment.
That's fantastic. So we talked about behavioral therapy. We also talked about medication. There was a third component to what you mentioned you use with treatment. What was the third component of that? Medication, behavioral therapy?
Behavioral therapy, and something called neurofeedback.
Yes, neurofeedback.
Neurofeedback has been around since the 60s. It was used by NASA and the astronaut program. It's a very safe, basically, in short, it's a form of biofeedback, which has proven very successful. But this one is subconscious and unconscious. We measure the child's brain waves using something called a brain map. I actually have some of the components here. We hook this up to a child's scalp, and there's small little things that go on the scalp and read the brain waves. Right. Nothing goes into the brain; it's just on the skin.
Right.
And then it just reads the brain waves, and it will tell the computer where the brain waves fall based on research. If the brain wave alpha, beta, delta, theta, gamma is above or below the optimal range. And the optimal range, as I said, is based on research that shows this is healthy functioning. Some research shows that kids with ADHD have elevated theta, or, it depends on the child, but the brain map is a kind of diagnostic picture of what's happening with the brain waves. Based on that, we create a protocol in a computer, and the protocol reads the brain waves and sends a signal to the television. So the child is actually watching the television during this entire time, which makes it fun. They can watch Netflix, kids, any kids show, Captain Underpants. Then the screen dims based on what the computer reads from the brain. And this uses operant conditioning to send a signal to the kid's eyes to activate or deactivate the brain waves. And there's probably a lot more to that, but that's the basic structure, and it seems to work. There are a number of research studies that have shown that it's very effective. So I recommend this for parents that are not going to pursue medication at all. It's a 40-week, it's about 3 to 6 months coming in twice a week. And over 40 weeks, I have had success with kids showing, more focus, calmer, able to sustain attention and effort on homework. So that's the third leg in the treatment that we offer. So it's neurofeedback, recommendations for medicine, and coaching, behavioral therapy, and social skills groups.
Awesome. Fantastic. All right. So that's the treatment part of the discussion. Let's talk a little bit about something that's super important. And a lot of parents often will overlook this, and because they'll be so focused in the younger years, they don't know what to expect as their child with ADHD grows up. And we just touched on this a little bit. Let's go deeper into that. What do you see happening, and what do parents really need to be aware of as their child grows into their teen years and adulthood?
Okay, well, I talked about the course of medication usage in kids, in that by teenage years they stop using it. It's hard to make them, and then you have a decrease in functioning in 9th and 10th, 11th grade, and then hopefully they realize the importance of it in high school, but often it's not until like sophomore year of college that they realize how important it is. So that's medication. What I see with kids with ADHD is a 30% kind of developmental delay in maturity. So that all will iron out when the child is an adult at 25 or 30. But for example, the transition, so a 12-year-old or an 11-year-old that's transitioning to 6th grade may have a hard time because intellectually they're functioning at a 6th grade level or even higher, but their emotional functioning is still at like 4th or 5th grade. They say there's a 30% difference between an ADHD child and a neurotypical child. And how that shows up is with friendships, and especially in the middle school years of when more socially adept kids are, interacting with opposite sex kids. These kids are still playing with Pokemon.
Right.
That can be challenging. So the hard years are between 6th and 7th grade, or whenever middle school starts in your neighborhood. And then from middle school to high school can be really challenging. And then especially college, high school to college, because at each stage, the child is a little bit immature. And this shows up too in 3rd grade when kids are learning reading and are beginning, especially the boys are going from kind of rough and tumble play to a little bit more sophisticated play.
Right.
And if your child is ADHD, they're still, functioning at, as far as play and emotional connections, at around 1st or 2nd grade. So there's kind of an emotional immaturity that happens. And as I said, this goes all the way through. That's all the way through college. That's why I highly recommend things like a gap year, which is a year between high school and college, that a lot of people in Europe take to grow and develop. And it can be an exciting, fun year between high school and college. And I think you can even defer. You can be accepted with your friends and defer it a year. That I recommend to kids with ADHD. I also recommend not rushing the kid through into 1st grade. If they have 2 years of kindergarten, that's fine. Or 2 years of pre-K, that would be fine. So the kids should not be young for their year when they start school. That would not be good, because they're already young and then they're chronologically young.
Got it.
So that's some of the problems. There may be an increase in impulsivity in teenage years and young adult years, in drinking or experimenting with drugs or driving too fast or things like that. So that may be something you need to watch out for as the child becomes an adolescent. And then on into adulthood, the child may need additional support. So again, with college, I don't recommend the child fly. If you live in New York City, I don't recommend the child go to school in California, because there's going to be a lot of problems that occur, and you want to be able to know what the problems are quickly, because they won't tell you. But if they're around and doing their laundry at your house, you may get a better picture of what's happening. So I recommend kids go to college closer to home.
Right. Okay, awesome. And so it seems like, let's take sexual activity, for example. When a child becomes a teen and they start experimenting with that, their mindset, even though their hormones are kind of starting to rage, their mental capacity to handle that is much younger, right? And so they may not make the correct choices. Is that the type of thing that you're talking about happening as they get into their teenage years?
Yeah, that type of thing. Poor decision making, impulsive decisions. So yeah, you should definitely have a talk about sex. Not necessarily how sex works, but appropriate behavior and consent and all those kind of really important questions that could really get the child in trouble.
Right, and that's where I was leading to. It's like, okay, so if we know that that's happening biologically, they're having urges, mentally they're not ready for it, then how do you have that discussion with them about that? And I guess what you have is how to be protected, how to make sure you don't get an STD, how to make sure you don't have a pregnancy, that type of thing, right?
Well, with sex education, it's very important to start in 4th grade.
Okay.
So that you don't have the big talk. I don't recommend the big talk, because that won't go over well. But if you start in 4th grade talking about sex, there's wonderful books on explaining, you know, the biological functioning of sex to kids at that age. And then by 5th and 6th grade, you can talk about girls and meeting girls and crushes. And they're short little bursts of conversation. They're not painful long ones. So, and then by 7th and 8th and 9th grade, you know, it's like, okay, you know, who do you like? You know, and then you talk about sex like you would any, you know, any other thing, and it becomes destigmatized.
Got it.
So that you can continue to have conversations and the child doesn't like plug their ears.
Now, what about, and it sounds like all of these things it's really a matter of communication. It's a matter of, like you said, destigmatizing them, things like drugs and alcohol, and being aware of that. Do you have strategies on how to talk about drugs and alcohol, and making sure, you know, what age do you talk about, making sure they're aware of it, and, you know, to stay away from these things?
Again, I think you need to start in 4th grade.
Okay.
Talking about, you know, kids are now vaping and juuling in 6th grade in Manhattan here. So, you know, at 4th grade, I think that's about 9, 8, 9. They'll actually talk to a parent about these issues because they're curious. But towards 6th grade, they're not going to want to talk to you. So that's why it's important when they're eager to, you know, have it. They don't really know about it. Then and then you continue that throughout the school year, then they're more apt to talk about it. And then you can, with regards to cigarettes or vaping, you can show them the research about how it can really and things like that. So it's a delicate balance of not scaring a kid to death. They will be experimenting, but at the same time, you know, telling them the truth.
Got it. Do you have any strategies around the discussion around college? So one strategy I heard you say was keep them close to home, right? So you can help monitor and guide them as they're going through college, because really they're a younger mind going into an older atmosphere. And but what about getting motivated to college? I mean, do you start that just in like 12th grade, or do you start it, you know, later in
well, I think it's very important, especially because of the price of college. If you can only afford, like most people, a certain college or a state school, or it's very important in 9th grade, before they start really considering colleges or they feel peer pressure, to explain to them the actual facts about what your family can afford. I think that's very important, so that they don't get pissed off 11th grade when they want to go to this expensive school and you say we can't afford that. So I would start the college conversation about what's realistic in 9th grade. And then there are some programs, if the child really struggles, like, for example, you can Google ADHD programs in college, and a number of universities now are supporting kids with executive functioning coaching and tutoring. I could think of University of Denver has a great program, and University of Arizona. But again, it would be good if you lived around those places.
Got it. Got it.
But yeah, to answer your question, I see a lot of what they call scaffolding in high school. Parents really supporting an ADHD child, sitting down with them, doing homework together. And the problem is that gets them through high school, but it's a disaster in college because they're used to all this focused attention. So I think you really have to withdraw some of the scaffolding by 10th grade, and substituting you for a tutor, or I actually don't like that word tutor because kids don't, you know, I would say maybe a homework buddy, some young person, a college student, to come into the home two times a week, 3 times a week, just to sit with the child, motivate them to do the work. That is scaffolding, but it's not dependent on you. And then when they get to college, as I said, there are programs where something similar happens, where they have to check in 3 times a week with, you know, the accessibility office or some system at school.
Got it.
But I think it's important that the parent withdraw their time and focus support, by 10th grade.
Got it. It sounds like if you can make the high school experience as similar to college as possible, that's a big benefit for your child.
Exactly, right.
Okay, all right. We're just about out of time, but I really want to talk about this topic of getting a job and starting to work. What are your strategies and what have you seen around that? What really works when it's time to get your child prepared for work? When do you start talking about it? When do you start, and how do you motivate them to do that?
Well, again, because of the emotional delay and the problems in learning, I think you're going to have to start at 16 or 15 and a half, whenever you can start working, and help the child at that time learn what's expected in the workplace. And there's going to be a lot of trials and tribulations and getting fired and issues, but let's sort those out in high school before they get the real world. So I support kids working at 16 all the way up through college. All the way up through their first job. And that's a very important habit to teach a child. And then the importance of follow through and finishing and being accountable. So that can only really happen through trial and error in high school when a parent is around. That can be a part-time job, dog walking, mowing the lawn, working at the local restaurant.
Maybe seasonal jobs, working in the Christmas tree lot, things like that.
Yeah, seasonal jobs, things like that.
Got it. And do you have the idea of paid chores and things like that to start that process of understanding how things work and having standards and things like that type of thing?
Well, it depends on the chore. I think some chores are automatic and part of living in the house. Like, I don't know, taking out the garbage or cleaning your room, or there's some expected chores that everybody in the house does. But, if you want the child to mow the lawn or pick up the leaves or to paint the garage, that would be, wonderful opportunities at 12 and 13 to teach the child about accountability and timeliness, and communication is really important.
Fantastic. Well, thank you so much for your time, Dr. Sachs. It's been a wealth of information, lots of stuff covered here today. And I understand that you have a free gift that you want to offer our audience.
I do. I have a 7-day crash course in adult ADD that's emailed directly to you. All you have to do is sign up on the link provided, and every day for 7 days, you'll get wonderful tips, tools, and techniques from me on managing adult ADD.
Awesome. So that link will be on the button on this page. You'll see it clearly. And just click on that link and you'll be able to sign right up for that, for Dr. Sachs, a 7-day free e-course. Awesome.
Thank you
well,
very much.
Yes, thank you so much. And just so people know how to find you, you have something called the Sachs Center. It's in New York City, I understand, right?
Yes, it's a private practice on the Upper West Side of Manhattan. I do obviously therapy here, and I also do therapy on Skype. You can reach me at sacscenter.com or 646-847-9722.
Got it. So if you like what you heard and you want more information, you have questions, you can always reach out to Dr. Sachs, and then don't forget to sign up for his e-course, and you'll get even more information. It's super important that you understand ADHD and embrace it, and it will go a long way for you and your family. So Dr. Sachs, thank you for being here, and thank you for watching, and we'll see you on the next episode.
Take care. Bye.